While I was training in medical school, I was doing an elective and fell in love with the field of physical medicine and rehabilitation. I came out to JFK Johnson. I saw the amazing culture that was here and decided to train here at JFK Johnson. Hi, I'm Dr. Sarah Cucurullo, better known as Dr. C. I'm the chairman, professor, and medical director of the JFK Johnson Rehabilitation Institute. I'd like to talk to you about JFK Johnson Rehabilitation Institute and tell you why I think that it's so special. We're very fortunate that we have specialists within our facility right here that are specialists within all the different fields. While you're here as a resident, you are taught by these amazing physicians who specialize in the field of PM&R, and you have a one-to-one attending resident ratio.
Having that one-on-one exposure really allows us to get to know that resident, teach them in the most holistic way we can, and so much so that by the time they graduate, they really are our colleagues.
And when we look at JFK Johnson Rehab Institute, you are always going to find top specialists in the field located right here.
While I was here as a resident, we started to develop the resident curriculum. I was then hired as an attending. While I was an attending, I was asked to start the PM&R, or Physical Medicine and Rehabilitation Board Review course. I started that in the early 90s. While I was doing that course, I developed a full set of notes. In 1998, the year that I became the Residency Program Director, I was approached by Demos Publishing to publish those notes.
You'll go all over the country, you'll see people using Dr. Cucurullo's Red Book, the Board Review Book, and that was literally created here, so the attendings who are writing those chapters are the same ones that we're rotating with, that are lecturing us, so you really are working with leaders in the field.
Our curriculum is based on 12-month blocks, which means by the time you get here as a PGY2, and by the time you graduate, you'll have covered the material 3 times. Our rotation blocks are also 3-month blocks, and so being with an attending one-on-one, you kind of really drill down the material. And really by the time you leave here, you're just incredibly well prepared, and I think that's really well reflected in our 100% board pass rate.
After 3 years, you have a full clinical competency portfolio, and our goal is to make you competent in every area and in every procedure that you do here in PM&R. So this goes for EMGs as well. You're assessed on all the procedures that you do within each of the different areas. EMGs, musculoskeletal injections, spasticity, and you're assessed that you're fully competent.
I got to work closely with all the attendings, the faculty, the rest of the staff, and I really learned so much in a breadth of PM&R.
Another very special thing about our program is the research that we do here. We are a TBI, or traumatic brain injury, model system site, which is one of only 16 sites that are selected in the country. It's a NIDLA grant, that's $2.1 million, that we work to do research in the field of traumatic brain injury. We also do really very exciting research on stroke. It's called the Stroke Recovery Program, where we do cardiovascular conditioning, and it's for stroke patients, and it's a comprehensive program for stroke patients that we do only here at the JFK Johnson Rehab Institute. But the great thing is our residents work with our attendings. They execute these research projects, and as a result, any projects that they do, either with the attending or projects that they come up with on their own, we encourage them to present them nationally, and when they go nationally and present, we completely fund them for their presentations.
In terms of the wellness event we go have JFK, we actually go above and beyond. So the last couple of years we've done Top Golf, we've done rock climbing, we've done paint night, just really a variety of activities that really kind of help further build the culture here.
One of the best things about our program is our amazing residents. I've been a program director since 1998, and the thing I'm most proud of is the caliber and the quality of the residents we graduate here at JFK Johnson.
I chose JFK Johnson ultimately because of how well this program sets up the residents for success.
The close relationships we developed with the staff and the faculty. The small size of the program allows you to really have an intimate interaction with the attendings and of course the patients and the population we treat.
From day one, coming in as a resident, through fellowship and beyond, I always felt like my co-residents, the administration, the leadership always had my back, and I was always going to progress and learn and get so much from the environment here.
So I chose JFK Johnson because of three major reasons. The first was the strong culture of teamwork and support amongst the residents and also the attendings. The second major reason was because of the attendings that we work with. And the third was because of the location. Being close to these major cities is really nice as well, in addition to the wonderful Jersey Shore and the wonderful mountains that we have here for hiking. So it's got a little bit of everything, in my opinion.
The JFK Johnson Residency Program has a 5-star rating on Doximity, which is the highest rating. And Doximity is the leading platform for U.S. physicians who vote for residency programs. You are coming into rehab at a very exciting time, and we look forward to seeing you on our campus.